Thank you for joining today's NILE webinar. This is Lisa, the Education Manager for Immunize Nevada, and I will be today's moderator. Before we get started, I'd like to review a couple of housekeeping items. For any reason, if we get disconnected, please call in, log in right away. We'll pick up right where we left off. And please locate the chat box in the bottom left corner of your screen. If you have any questions, type them into the chat box, and we'll address those questions at the closing of the presentation. Secondly, if you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey in the post-webinar email. The email will be sent out by the end of the day today, and all CEUs will be mailed out within the next week. A little disclaimer, Immunize Nevada NILE webinars are made possible by the generosity of the speakers who donate their time and expertise to the benefit of the coalition. The expectation and goal is for community partners to gain knowledge on immunization-related topics through a non-branded, unbiased presentation. I'd like to now turn it over to our speaker, Dr. Chen, who works with Washoe County Health District, and she is the current epidemiology program manager. She previously earned her MD in China and then went on to earn her PhD from UNR in environmental sciences and health. Her interests are infectious disease epidemiology, outbreak responses, and traditional and advanced public health surveillance development and evaluation. We're so lucky to have Dr. Chen today, and I'll let you take it away from here.
Thank you, Lisa. Hello, everyone. So thank you, Lisa, for your invitation. So I'm happy to make this presentation today. I still remember last year I made the presentation with my co-worker here regarding talk about the norovirus outbreak. So today, I'm going to talk a little bit about notifiable diseases in Nevada and Washoe County. It sounds like a boring or dry topic, but I try my best to entertain the audience, okay? So just a heads up, okay, sometimes in my presentation, I may interchangeably use the terms like reportable disease, notifiable disease, or communicable disease, or infectious disease, or CD, which stands for communicable disease. So I would like to point out the meaning, okay, today in my presentation is the same, which means that these diseases are mandates by law. Here are today's objectives, hopefully, at the end of my presentation. Number one, to understand how notifiable diseases are defined and are regulated. Number two, to know what notifiable diseases are and how they should be reported, who is responsible for reporting and where to report. Number three, to be aware of the role of public health in preventing and controlling notifiable diseases. Number four, to be aware the role of you as a nurses in the community in preventing and controlling notifiable diseases. So how notifiable diseases are defined? So I may ask this question to you, or you may ask this question to yourself, because there are so many diseases out there. What diseases should be notified? Who makes that decision, right? So this is kind of very legitimate question. So I guess majority of you may guess, okay, it should be CDC. In fact, it is not. The professional organization called the Council of State and Territorial Epidemiologists is the one to make the decision. Every year, thousands of epidemiologists from the nation meet together for an annual conference. One important, very critical component for this meeting is to make a decision in light of adding diseases to the reportable list, or removing older diseases, or revising any surveillance definitions for the diseases currently on the list. The proposal we also call a position statement. That statement can be made by any epidemiologist from any state or working group at the field, and then discuss the proposal, the position statement in details at the annual meeting, and then vote by members who are eligible for voting by each state. Once passed by the CSTE, this position statement will go to CDC for its final approval, which is true. CDC has a role in that for the final approval, but the decision is actually made at the CSTE level. And once it's approved by CDC, that disease becomes an official notifiable disease on their recommendation list. Okay, and then CDC published that annually on their website. It's called National Notifiable Disease Surveillance System, abbreviated as the NNDSS. So I added that URL there, so for your information. In 2017, there are more than 170 diseases or conditions on their list as a recommendation, okay? So of course, this entire process is not just happened at the several-day meeting. It is a cumulative work from the field epidemiologists during the entire year. Generally speaking, once passed at the CSTE, CDC will approve it. So that's kind of the how notifiable diseases are defined at the national level. So you may be surprised to know there's no federal law for notifiable diseases in terms of the reporting investigation. All the previous NNDSS list is only for recommendation. Every state can make its own decision based on CDC's recommendation. So reporting those diseases to CDC is also voluntary based. Okay, I have to emphasize that because I was asked by my coworkers from the different programs, so they think it's mandatory, but it's not. Since I originally came from China, I was very surprised when I knew this system, which is totally different from the system in China. In China, no matter where you are located, every province has to follow the same law to report communicable diseases, which are listed in the law. And then every jurisdiction uses the same reporting system to report. In the United States, every state makes its own law based on the CDC recommendation, and then use a different system to report. So therefore, in the United States, every state has different notifiable disease described in their law. However, since every state is following the CDC's recommendation, majority of the states have a similar list for the notifiable diseases. In Nevada, Nevada revised the statute, which is NRS Chapter 441A, and the Nevada Administrative Code, NAC 441A, are reporting laws for notifiable diseases. NRS is the codified laws, but the NAC is the codified administrative regulations of the executive branch. So I remember when I taught MPH classes at UNR, I was asked by students, what are exactly the difference between these two? In fact, the law can mean a lot of things, right? From general ideas about jurisprudence all the way down to a written ordinance. While the words law and regulations are often used interchangeably, they can refer to very different distinct things. Although the effect of laws and regulations can often be the same, it is important to understand how they are different. Laws are the products of written statutes passed by either the Congress at the federal level or state legislatures. The legislatures created bills that, when passed by a vote, became a statutory law. Regulations, on the other hand, are standards and rules adopted by administrative agencies that govern how laws will be enforced. In Nevada, the State Board of Health is such an administrative agency. Like laws, regulations are codified and published so that parties on the notice regarding what is legal and what is not legal. And the regulations often have the same force as laws, since without them, regulatory agencies would not be able to enforce laws. In Nevada, health district is mandated to control communicable diseases. Investigating of communicable diseases is a cornerstone of public health, as this is an important surveillance for health assessment. Health assessment, which is one of the three core public health functions. Other two core public health functions are public policy development and assurance. So reporting is truly an essential part of the disease control as well. Okay, I apologize for this slide because it looks very busy. as I mentioned in previous slide, NRS 441A and NAC 441A are the laws to regulate notifiable diseases in Nevada. So NAC specifies what to report, who is required to report, the time frames for reporting. For example, a case of botulism must be reported immediately, while a case of chlamydia can be reported on the next business day. So what information must be included in the report? You don't need to worry about this busy slide. Just let me summarize for you. Of course, when you report the disease, we wish to include a disease name, the diagnosis, right? Contact and the demographic information of the case, their occupation, if known, employer, symptom onset, etc. So why would occupation be important? Because sometimes we need that information to make a decision if the case should be excluded from work and prevent from further spread in our community. So this is another busy slide because we copied from the laws. So this part of NAC 441A is specific to labs. Demographic information, date of specimen collection, date of result, lab result, ordering providers' contact information of the medical lab making the report should be included in the lab report in order for public health to initiate our investigation. So who is required to report? Of course, there are physicians, labs, healthcare providers, including nurses, physician's assistants, or vets. If you're working with a hospital, infection control practitioners are the one to be in charge of disease reporting, not individual nurse or physician working in that hospital. Of course, some exception, for example, like the weekend or the holidays, they cannot find the IC infection control practitioner. Sometimes we do get the physician's phone call from the hospital, which is fine. Redundancy is built into the system. I put the 2 stars there because these laboratories and the healthcare providers are most consistent reporters. Honestly, for any given case, we should receive at least 2 reports. However, this is not reality, So 2 reports, one is from lab and one is from healthcare providers or hospitals who order the test. So sometimes we were asked by the physicians, hey, this disease should be reported by labs, so I don't need a report. This is not correct because the laws for the Nevada NAC 441A requires you to report the disease to the health authority, regardless of what. Okay, it's your own legal responsibility to report any suspected communicable disease listed in the law. So do not rely on others reporting. We would rather to receive the duplicated reports, but we don't want to miss any single report. So where are communicable disease reported to? In Nevada, to the health authority having jurisdiction where the office of the healthcare provider is located. Okay, so this one is different with the majority of states. For other states, they are asking healthcare providers or labs to report the jurisdiction where the patient resides. So Nevada is different. So in fact, this law, we think is much easier for healthcare providers or labs because they don't need to take the time to figure out which jurisdiction the patient resides and which health department this patient is associated with. So if your practice is in Las Vegas, but you are seeing a patient from Reno, then you just needed to report that disease to the Southern Nevada Health District. Okay, you don't need to worry about to report it to the Washoe County. So please remember this one because this is very unique in Nevada. The population of Nevada right now, as of in 2016, is approximately 2.9 million. There are 4 health jurisdictions in Nevada state. Southern Nevada Health District accounts for like 3/4 of the population. Washoe County Health District overseeing like 16% of the population, which is including Reno, Sparks, and Washoe County. Carson City Health and Human Services is overseeing the city of Carson and the Douglas County, Lyon County. Probably they cover 3 to 4% of the population. And then the rest of the rural counties in the state and about 6% of the population are covered by the Nevada Division of Public Health, Public Behavioral Health, NDPBH. So for your future reference, for the next 4 slides, I'm including 4 jurisdictions reporting phone line, fax number, and their website. These information are the most current because I double-checked their website to make sure the information I provided to you is the most current. So generally speaking, disease reporting line is for 27. Okay, so every jurisdiction has a different way to manage after-hour calls from the disease reporting. I know we have lots of things to memorize, but if you are working with a physician in your jurisdiction, it's nice to memorize one single reporting phone numbers for your jurisdiction. So in addition, if you are trying to use the email reporting, because we do sometimes receive that reporting from the email box, and then please remember you must use a secured email to report a case in order to be in compliance with the HIPAA to protect their protected health information. So this is the kind of Southern Nevada Health District contact information. This is for Washoe County's reporting line information. This is for Carson Cities. This is for the Nevada State for the rural counties. Okay. Next one, which is also very important piece, is what diseases should be reported in Nevada. Okay, so I'm not sure if you can remember in the previous slide I mentioned in the CDC website there are more than 170 conditions and diseases listed on that recommendation list. So in Nevada, the current law specifies 78 communicable diseases or conditions are reportable in the NAC 441A. So here we use a different format just for easy kind of browse for the healthcare provider and the public health people. So here we have the one thing, it's called a carbapenem-resistant organism with a little star here. That is only reportable in Washoe County, started in 2017, which is new, because you remember the previous slide, local health officer have some legal authority to declare some special kind of extraordinary illness become the reportable. So for this one, CRO, carbapenem-resistant organism, is reportable by the hospital labs. Only in Washoe County. I know the state is working on that to make it kind of like a statewide reportable, but we are still working on that. For that, it's right now it's only for Washoe County. I know in Southern Nevada Health District, the health officer required them to report elevated heavy metals in human specimens. But that one is not reportable in Washoe County or for the rest of the state. So please correct me if I'm wrong, if any of you are from the Southern Nevada Health District later after this, I finish my presentation. Okay, so lab reports or mobility reports from physicians coming every day by fax or by the electronic lab reporting system, occasionally from the mails. Sometimes we do receive the mails from like insurance company or out of jurisdiction health department. So reports are reviewed and triaged as follows. So you can see this list of the disease, and in fuchsia color, these are sexually transmitted disease such as chlamydia and gonorrhea and syphilis and other conditions. So we triage these kind of disease to our coworkers at the Sexually Transmitted Disease Prevention and Control Program. And for the AIDS, HIV infection, or CD4 lymphocyte counts, those lab reports or morbidity reports we send it to HIV/AIDS program. And for the TB, we send to our TB program. Since the TB investigations are lengthy and require long-term follow-up for contact identification and the treatment of the infected individual, which is why there's always have the one special program designated in each health jurisdiction for this TB investigation. Although their case volume is not that high, but their contact investigation is very resource intensive. Okay, so for this slide, you can see a lot of disease in fuchsia color, which is kind of falling into our program, which is in the CD program or EPI program. So it's more than 60 different conditions. So just for your information, in 2016, top 5 notifiable conditions and diseases in Washoe County are, number 1, influenza. It's almost 3,000 cases reported. Number 2, chlamydia, which is over 2,200 cases reported. Number 3 is animal bites, which is over 1,000 cases reported. Number 4 is hepatitis C. It's almost 700 cases, those including chronic hepatitis C. I have to mention that we received lots of the reports for Hep C, but these about 700 cases are newly identified and reported in 2016. Gonorrhea is another one of the top 5. It's over 600 cases. So please note that this ranking is changed from year to year. So this is only for 2016. Influenza varied significantly based on different seasons. Okay, what tool do you use for disease reporting? So I'm kind of including 2 disease reporting forms here. The left side is a Washoe County form. The right side is a statewide disease reporting form. So you may ask why we don't use the same form. The reason is for the left side of Washoe County, we have been using this kind of format of the form for long time. Before I came over, I think it's at least over 20 years, maybe 30 years, we use this kind of form. And the right side, and it's kind of it's probably like 10 years-ish. So for the convenience for the healthcare provider, we just didn't change the form. But I have to say the contents are same because all of us working together to make sure the contents and data elements are same. So we accept all different types of the forms. It doesn't matter. So, as long as you include those core elements required by law, which is we are fine. So for these kind of disease reporting form, always can be downloaded from your health department. I also recommend you every year, if you are working with some sort of a healthcare facility, every year, beginning of the year, check with the website for updated information. Okay, what happens once a case and a disease is reported to the health department? So each health department actively investigated almost all reportable cases. Okay, one thing I forgot to mention that because we have so many reportable disease, and for Washoe County, we only cover the 16% of the population of the states. Just for your kind of perspective to see what is the reporting volume. So every day we probably if we use the fax to measure that, we probably at least we receive like 250 or 300 pages of fax sometimes more than that. Of course, right now we receive the more electronic reporting through the system from the lab. You can imagine for the Southern Nevada Health District, what is the reporting volume? It's huge. We need to have a dedicated staff to check at least 4 or 5 times a day for every day for the incoming lab reports or mobility reports. Okay, back to this slide. So after we got the reports, okay, we investigate almost all reportable cases except like influenza or rotavirus or RSV, which is we just just report it as aggregated numbers. We log them, we document them, we have the case count, but we don't investigate each individual case unless it's a pediatric death associated with influenza or some novel influenza strain we probably see, or outbreak. For any disease outbreak, we investigate that. So we also evaluate lab results. This depends on the disease that is reported. For example, if it is a salmonella case, the results are pretty straightforward because it's usually isolated from the stool. It's a stool culture. However, it is a disease like hepatitis B. The results can be a little bit more complicated because there are so many tests involved, and we needed to contact the lab if necessary or the healthcare provider to look for additional test result. And we also call the healthcare provider or contact the hospital to obtain the medical records and review the medical records. And then we conduct interviews by phone or face-to-face. I have to say 95% of the time we use the phone interview with the case to obtain exposure history, ask their symptoms, identify potentially exposed person who are contacts, which is require prevention or prophylaxis. So not only healthcare providers or hospitals we contact, sometimes we also contact with the school nurses, with the daycare providers, with the employers at the casino or restaurant or other government agency. It really depends on the disease. And we also follow up with the contacts identified through the case investigation. We perform some additional testing if necessary, and provide prophylaxis as appropriate. And as I said, we collect some specimens for those contacts. If one of the household contacts of salmonella cases work as a food handler in the restaurant, they are symptomatic, and we collect a specimen and to make sure they are okay to work. Make sure they are negative before we know the lab results, and then allow them back to the work. So a lot of time we collect our public health agency people. We collect poops, the stool specimens. So our coworker, environmental health specialist, they are the field person. They are the one to drop off the specimen collection kits to the contacts, and then sometimes we ask those people come here to pick up the specimen collection kits to collect samples for us. And then we also provide education on the disease transmission and the prevention, provide some general prevention message to them. So this is an example of the case report form. This one is just for one of the many disease investigation form. This is for salmonella infection investigation. For example, for every single case, We interview the patient, we collect their demographic information, contact information, clinical course, symptoms, treatment if available, severity such as hospitalization and outcome, and then we gather their risk factor information including 72-hour food history, where did the case eat, if they eat outside of the home, which restaurant they go to, and what is the location of that restaurant. We also ask a high risk of food consumption during 72 hours prior to the onset of disease. For example, you can see this kind of box, probably it's too small for you, but this is kind of box for the high risk of food based on the Salmonella epidemiology data. So we also ask the other risk factor, including animal exposure, recreational water exposure, travel history, etc. So all these kind of here. This is kind of the electronic form. While we do the investigation, our investigator filled out the form. And I have to say, because of our diligent work, day-to-day work, we detected so many outbreaks because of our routine jobs. So we also gathered their household contact information. Who are they sick, and what's their occupation? If there are any sick household contacts who work in the sensitive occupation, which is food handler or healthcare worker or daycare provider, or they are daycare attendees, they require exclusion, we will do that. And so that's kind of example for salmonellosis investigation. Okay, well, after we complete our investigation, what to do next? We report to a surveillance system. It's called NBS. Okay, so NBS, it stands for NEDSS-based system, which is the surveillance system used in our state. I have to say, used by our state, but not by the Southern Nevada Health District. Southern Nevada Health District uses a different system, and but this system is a system for us to report our case to the state, to the CDC. So NEDSS stands for National Electronic Disease Surveillance System. NBS system has been used more frequently by right now is more than 20 states are using that. Did you remember in the previous slide I mentioned that, okay, every state is using the different system? Yeah, that is one, because California is a different system, Massachusetts is a different system. But anyway, all of the states are reporting such surveillance data to the CDC. And then, so CDC is kind of, the data is sent to CDC by stripping out like patients' names, personal identifiable information, contact information. At the CDC level, they don't see who are those patients, what is the contact number. Those kind of information didn't transmit. So national data is compiled by CDC and published weekly in the MMWR, which stands for Morbidity and Mortality Weekly Report. It's available online. If you haven't had a chance to look at that MMWR, I really recommend. It's a very good resource for us, for everyone in the public health field, to know what's going on in the nation or in the world. I have to mention, because I published several reports and articles as co-author or the primary author with the MMWR, their impact factor is very, very high. So impact factor, last time I checked, it's 11, which is very, very high. So, so yeah, please, I highly suggest to subscribe that MMWR subscription to get know what's going on in the nation. So if you would like to see what's going on in your own community regarding the notifiable diseases, I suggest you visit the respective health jurisdictions' website for statistics. In Washoe County, we published the quarterly statistics via EpiNewsletter, and we compile an annual summary as well. So here I included our links here. This is a kind of example for our Epi News. So the Epi News is produced by our agency and sent to the local hospitals and the labs and the healthcare providers working in Washoe County. We do that. We generally publish the newsletter every 2 or 3 weeks, and we primarily focus on the subjects including the emerging infectious diseases, outbreaks, and the statistics. Sometimes we do including some like chronic disease like obesity, or some other hot topic like Zika or Ebola, things like that. So this is a kind of example for the quarterly statistics. We have the list of the disease here. We put the kind of the quarterly stats and the year-to-date cumulative stats for the past 3 years, past 2 years and the current year. The left one is we call it Figure 1. Actually, we adopted the CDC's methodology for their Figure 1 to compare the current case counts for selected disease in comparison with the historical 5-year trend. So we come up with, okay, whether this disease is increased or decreased. So this looks like a very simple graph. However, behind the scene, it's very, very complicated, involved a lot of statistical calculation and graphing. It's not just a simple bar chart. It's way more than that. So I think at this time probably we are the only jurisdiction we have this kind of, it's called a Figure 1. CDC has the same Figure 1 every week as well for the national stats. Annual summary. We just recently published our Washoe County's annual summary, which compiles all epi-related epi data for communicable disease in Washoe County, including STD, HIV, TB, vaccine-preventable disease, enteric diseases, hepatitis, vector-borne diseases. Okay, so we divided it by kind of have the different chapters based on the transmission route. So in this document, we not only just published some numbers, okay, some statistics for the cases, but we also published the statistics for intervention and prevention. For example, like in the pertussis section, how many cases, how many contacts we identified and provided for prevention. And then we also published the risk factors for every disease. We tried our best to provide a very good epidemiological profile for communicable disease in our community. So as you may be aware, as I mentioned, the 3 core public health functions are assessment, policy development, and assurance. Reporting of notifiable diseases mandated by laws is critical for public health agency to perform health assessment using surveillance tools. One of the primary utilities for investigating notifiable disease is to detect outbreaks, identify the source, and control the disease spread. That's kind of our primary responsibility. Therefore, our daily jobs are very challenging and exciting and fun and keep us very motivated every day. Here are just a few examples of outbreaks which were detected through our day-to-day investigation. So the first example was the salmonellosis outbreak associated with the contaminated white ground pepper in 2009. We identified an outbreak after we received 2 cases with the same rare serotype of salmonella, which called Salmonella ricin. So just for some people you don't know the background of the salmonella, there are over 2,000 serotypes of salmonella. So Salmonella ricin was a very rare serotype. Before 2009, we never received that report. Our state lab was the first lab in the nation to identify and post it to the national database, which is called PulseNet. In fact, multiple states, including California and Oregon, see the same strain. So several states, we worked together. After 3 weeks, we worked together. We quickly found the source, which was a contaminated white ground pepper processed at the Northern California manufacturer. The final case count was 64 from the several states. Because of the quick identification of the source, it's only 60. Yeah, we say 64. It's a lot, but compared to other salmonella outbreak, it's very common to have the hundreds, thousands of salmonella cases associated with multiple state outbreak. But this one, it's because of quick identification. It's only 2-digit number associated with this outbreak. And the final culprit is the whole pepper imported from the Vietnam, and that whole pepper ground processed at this Northern California manufacturer, and that manufacturer, there was gross contamination in their environment. The second example was the giardiasis outbreak associated with the local golfing course. Through our routine investigation, we quickly identified this outbreak. About 19 people had a laboratory confirmed giardiasis, which is another diarrhea illness caused by parasites, giardia. The cause was the final cause was the ditch water used to irrigate the golf course, which heavily contaminated. And the golfers practiced high-risk behaviors while golfing because we did some epidemiological study, and we found that issue. The third example was a hepatitis A associated outbreak associated with the antioxidant frozen berries sold at Costco in 2013. This turned out to be a multiple state outbreak involving more than 100 cases. We only had 3 cases at that time, but I have to say we were proud to be one of the first 3 jurisdictions identified the case and collected the contaminated product for testing and sent it to FDA for traceback. So we had 3 cases. However, our clinic vaccinated 100 persons who reported consuming that product. The source was one ingredient in this mixed frozen berries. It's one ingredient was imported from Turkey, from out of the country. The last example, just the last outbreak was occurred just 2 years ago. A total of 25 cases were sick with sugar toxin producing E. coli. The final cause for this outbreak was chocolate mousse cake prepared at the local manufacturer A. That manufacturer and then distributed to 2 local restaurants. The cause was that the manufacturer A used the same mixer. That mixer was used for both chocolate mousse cake and raw beef. That is a severe cross-contamination. So this is kind of, for example, just a tip of the iceberg. We identify, the outbreaks we identified through our routine investigation. So this kind of like illustrates how important for our day-to-day job, how important for the disease reporting. Because if without the reports, we cannot initiate our investigation, right? So, okay. Having said that much, I kind of put this slide together to summarize the roles of public health in notifiable disease mandates. We are the one to identify the source of infection. We are the one to provide prevention and prophylaxis to susceptible contacts and stop further transmission. So we are the one to understand the course of a disease and identify any newly possible transmission routes. For example, like last year and the year before for Zika. So you probably never, imagine Zika can be transmitted sexually. So detect outbreaks through day-to-day investigation. Definitely, we played a big role there. So we contributed to infectious disease epidemiology for some evolving kind of emerging infectious disease because the organism they are evolving, right? Science is always evolving. Therefore, understanding epidemiology better for these evolving disease is partially relied on our field work. So not just for lab, just for research lab. So it's from the field work we contributed a lot because of our local field work and contributed to the nation. So that's kind of CDC can kind of see what direction we should go. And then contributed to intervention. The best example is that every season we perform the flu surveillance. We use the findings to contribute to the decision-making at the national level regarding flu vaccine components for the following season. So we are not police. We are not the police kind of wearing the forms. However, we are the communicable disease police, without wearing the uniform. We are disease detector. So we are kind of ensuring those infectious people not working in the duties in some occupation and then to serve as the source for the further spread in our community. So we are also one to contribute to the policy development. For example, like as I mentioned, for the 441A, NAC 441A updates, revisions. So we always work together by the work with the state, multiple local jurisdictions work together to see what kind of the languages we should change. We should to propose propose to the legislature for change, or propose to the State Board of Health for change, for revision. Okay, so the next one is a final slide. Because I know you are the nurses working with the NILE and working with our community, working with the different coalition. So you may ask, what's my role here? So here's a kind of summary I put together. I look at them from three different angles: primary prevention, secondary prevention, and tertiary prevention. So for those of you working at the clinics or different outreach clinics to provide vaccinations, to get our kids or adults protected from a lot of vaccine preventable disease, we thank you so much for doing that voluntary work. You truly played a very important role in primary prevention, because we needed to prevent disease first. So once those people who are get ill, and if you are nurses working in the clinical setting, so always, all the time, in early detection, early diagnosis, and early reporting, timely reporting will be very, very critical for public health to prevent, to initiate the investigation, to prevent the further spread. So sometimes we also ask the healthcare providers assistance in investigation and or prophylaxis. So you do play the role if you're working in those settings. For those who are already ill, and the timely treatment and appropriate case management will definitely reduce the mortality rate. That is a role I can see the clinical nurse can play for the tertiary prevention. For example, like TB case management. So it's primarily the public health role, but sometimes the clinical nurse may contribute to that as well. And then, for example, like Hansen's disease, sometimes we rely on the clinician to help for that case management as well. So I think that's kind of I put together for the role of the nurses. So finally, I would like to kind of use my personal story to conclude my presentation for today. So when I went to the medical college in China, it's my school is called Nanjing Medical College at that time in the in 79. So right now it's called Nanjing Medical University. It's one of the top 10 medical university in China right now. So we had three majors in that medical college. One is clinical medicine, one is public health, one is dental science, dental medicine. So almost for every student, so we wanted to go to the clinical medicine because we can fill out two If the first choice is clinical medicine, second one is public health. If you pick the public health, you put the second choice, you will get to the public health major without any negotiation. So because you are applying for medical school, so you pick the public health, you will go to the public health because unless you don't pick that public health. At that time, I was very frustrated because I wanted to be the medical doctor, especially want to be the surgeon. So, but I end up into the public health major because the public health major in China is always in the medical school. So I still remember the first day when I came to the college, my professor is epidemiology professor who actually studied in the United States. And he used English to let us know prevention is the first, treatment is the second. He wanted us, all the students, to know, please remember by heart. So I think for those of you who practice, so giving the vaccination to play the important role in primary prevention. So as epidemiologists in the health department, we are so thankful for that. And I think that's my presentation. I can see we still have some 10 minutes-ish, and so I'm happy to take any questions you may have. Lisa?
Yeah, hi, great. Thank you so much for sharing your personal story at the end there. That was really relevant and meaningful. So thank you so much, Dr. Chen. Before we say goodbye, we would like to offer a little bit more time for last-minute questions. So please type those questions into the chat box now. While we are waiting for those questions to be typed in, just a couple of reminders. If you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey in the post-webinar email. The email will be sent out by the end of today, and all CEUs will be emailed within the next week. If you'd like to view or share this webinar, the recording will be available on our website along with information for future webinars. Please visit immunizenevada.org/webinars for those details. So we will give everyone just a second here to type any questions in if they have any. Although your presentation was so thorough, I don't know what.
Oh, thank you so much. Thank you so much. I'm not sure if it's kind of appears to be very dry topic. That's why I kind of included some examples of outbreaks, because I know in the UNR when I make my guest lecture, students love to hear the stories about outbreaks. So I tried my best. Yeah.
Yeah, no, I think you did a wonderful job.
I also included the contact information on the first slides as well. Yeah, so if you have any questions regarding communicable disease, so you can always welcome to call our 24/7. Of course, for the information only, just to kind of call us at 328-2447, or we have the general email box, and they were forwarded to me if you have questions later. So you are welcome to contact.
And also, too, just as a reminder, if anyone has a question today or it's something more detailed or something like that, we, through the webinar, they have an opportunity to ask questions too, and then I receive those questions and I can also forward those on to you. So there's two different routes that people have to get more questions to you or start a conversation with you.
Yes.
Okay, and I'm not seeing any questions in here so far. So like I said, it was a very thorough presentation. Do you have anything else to add?
No, at this time. Thank you so much for this opportunity.
Yeah, we are so grateful to have you speaking, and that does conclude today's NILE webinar. Again, thank you, Dr. Chen, and those who have participated. So have a great day, everybody.
Thank you.